from Feel Good Functional Medicine, and this is a continuing series on how you can feel better from pain. So my goal would be for you to be permanently pain-free. Wouldn't that be great? And to be able to manage aches and pains as they come up in your life. And this is part of a series that's in my new holistic healing and anti-aging community. I do want to mention that this is for educational purposes only. Anything that I suggest to you, you're going to want to check out with your physician, with your primary care doctor. And if you want to sideline me with questions, you might want to be part of my Energy for Life community, where these kind of things are available for everybody all the time. These kind of talks. I've got many courses on pain, sleep, gut, functional medicine courses, and I would love to include you so that you can learn more about how you can really help yourself feel better. So let's talk a little bit about pain and what are the types of pain. Pain is a complex, multifaceted thing that affects so many of us. It keeps us out of work. It sometimes can prevent us from really enjoying our life deeply. And it's not just a physical sensation, it's an emotional, psychological experience. And now with the new research, we understand that chronic pain actually changes the connections in your brain. It can change the size of certain parts in your brain. And what's interesting there is that it can change it so that we're giving more real estate of our brain to the pain, and we can change it back. So we're giving less real estate of our brain to pain. So I'm going to talk briefly about the different types of pain and how to kind of figure out what's going on in your body. And I think the important thing to understand is that all pain sensations, while they feel like they're in the spot that's hurting, they are originating from the brain. Most people, when the back starts to hurt, we go, oh, my back is hurting. But in fact, it's your brain that's hurting. Your brain is where that pain is coming from. So let me go briefly through the types of pain so you can start to think about your pain in terms of how we can move it through and get it better. The first thing is body pain. Body pain, or nociceptive pain can be of two types. One is from the skin, muscles, and bone, right? You get a cut, nociceptive pain, body pain. The other type is visceral, or like from our innards, from our organs. And it's important to differentiate these because we're going to treat them in different ways. When the doctor says acute pain is talking about something that just happened because of a sudden injury, like you had surgery, you broke bones, you got something done to your teeth, you got a cut or labor and childbirth. So those are acute pains. Something's going on structurally in the moment that's causing the pain. So that shouldn't last a long time, really. When we think about how long, acute pain lasts during the injury and maybe for a short while you're healing up. Acute pain does not last longer than 6 months. So if you have a pain that's been going on longer than 6 months, even if it doesn't mean that spot is still broken, what it means is that since that time, you have had a change in your pain pathways. And this is something that is addressed in the Curable app. And I have other videos talking about how we can use that mind-body connection to reduce the pain connections that have sprouted. But it's important to realize that acute pain doesn't last longer than 6 months, right? And we mentioned the kind of pain that comes from skin, muscles, and joints, but then also we have that coming from from your gut, right? If you have irritable bowel, Crohn's disease, ulcerative colitis, these can cause abdominal pain, from all the different things within you. And of course, there's, heart pain. And, it's a good moment for us to think about, well, what are the pains I really have to pay attention to, like right now? And I think understanding that there's things that you do need to check out right away: chest pain, You just have to check that out. Don't ignore chest pain. Don't ignore a thunderclap headache, a severe headache, because it might be a stroke or an aneurysm or something else like that. Don't ignore severe abdominal pain, especially if it is sudden and intense. Might be appendicitis or abdominal aortic aneurysm. The other question is, when is my back pain dangerous? Never ignore back pain that comes with neurological deficits. So if you have back pain and you also have numbness or weakness, loss of bowel or bladder control, it's very important that you seek help from someone to evaluate. Also, severe pain after an injury, especially if it's swollen, if it's swollen up. I remember back when I was in my 20s, and I injured my foot, as I had injured my foot so many times. And, it was swollen and red. And I remember being at the Braves game in Atlanta with a friend who was in medical school. And she looked at my foot and it was sort of blue on top of it. And she was like, that you need to go have that checked out. So persistent severe pain and swelling following an injury, especially an inability to use the limb, might have something broken. The other pain that would be concerning is pain with a fever. It might be a bad infection, any severe or persistent pain that you haven't now evaluated. And then pain in pregnancy is something that needs to be checked out right away, especially if it's combined with any kind of bleeding or anything like that. So sorry for the aside on pain you cannot ignore, but I think that's important, because what we want to know is which pain can I start to use my mind-body connection in order to change my experience of the pain, change the neuropathic pathways that are creating this and perpetuating this, if you've had pain for more than 6 months. The other kind of pain we commonly see is nerve pain or neuropathic pain, a big word for it. It tends to be kind of burning. It might be tingling. It might be numbness, pins and needles. It can be very sharp shooting. And that can be like the kind of thing we see with diabetes, multiple sclerosis, neuropathic pain. Sometimes after spinal cord injuries or after a previous injury where the nerves basically got angry and they just keep talking to you. There's some very specific kinds of pain. So when we have chronic pain, we need to think about it a little differently. Number one, it is so important to be aware that chronic pain is representative of you've created new pathways that you can change, right? Neuroplasticity tells us that these pathways that have been there a long time can be changed. So we want to use the brain-body connection to do that, but we also want to recognize that sometimes some of that pain is coming from other issues that we also can do something about, and that is not enough blood flow to an area. Yeah, you guys ever exercised and felt the burn? Well, not enough blood flow to an area can cause an area to be uncomfortable. And if you have, we kind of think of diabetic neuropathy as a problem related to poor blood flow to the nerves that are feeding the feet. And that's part of why that happens to people. So if poor blood flow is an issue, improving it can help the issue. Another thing that can happen when we have an injury, when we have surgery, when we have whiplash, is that stuff can get stuck together. It's a very official term. That's what we call scar tissue. And when tissues stick together, when fascia doesn't slide, when I move my shoulder and I pull my arm up over my head, there's a whole bunch of planes of tissue that have to slide over themselves in order for the arms to move. And when fascial planes get stuck with what we call adhesions or scars, and especially if a nerve that should be running between two fascial planes gets stuck, every time you move your arm, it like yanks on it, and it yanks on the tissue, and that hurts. So managing the scar tissue is also important. And now there are ways that you can reduce scar tissue. We think of massage as one of those ways. frequency specific microcurrent can actually help with scar tissue. And interestingly, you know, if you look at the information coming out from Dr. Carolyn McMakin about FSM, frequency specific microcurrent, she's got a unique way to help people with fibromyalgia who've had whiplash. And she has a theory that actually that cervical trauma can lead to stickiness in the tissues right at the neck where all of the nerve impulses are running through there. And when those fascial planes don't move well, it could start to create a chronic body syndrome. And she's helped people with chronic fibromyalgia by treating the neck and helping with the scar tissue using microcurrent. So we think that of fibromyalgia as a syndrome of pain, and it is a syndrome of pain, but there may be a way that people with fibromyalgia could get complete relief. And there are case studies of complete relief from fibromyalgia by helping address probably a combination of the blood flow, mind, body, and the scar tissue. The other things that we see that can exacerbate, make pain worse are infections and toxins. They can drive pain. Less common than poor blood flow and scar tissue. But, you know, we know that people with Lyme disease have joint pain. There are lots of infections and toxins that can make it worse. Also, I would be remiss as a functional medicine doctor if I didn't mention that I've seen people with a food that disagreed with them. And when they stopped the food that disagreed with them, their joint pain got better, right? Because of this thing that can happen when you take in food that your body is sensitive to. Let's say it's some kind of wheat, right? Some kind of wheat that when you take it into your intestines, it causes something called leaky gut because it causes inflammation of the gut lining. And then what happens is all along your gut, that's where like the most of your immune system is. It's waiting, trying to see if what comes through your gut is friend or foe. Is that food? Great, let it on in, right? But when it gets leaky, everything comes through and it's trying to decide friend or foe, it can get confused and it can perceive something that looks a little bit like you, like maybe your joint capsule, and say, that's foe, that's right, that's not good. And then we can create an autoimmunity where we actually attack parts of our body because of this leaky gut. So that is the basic idea of why when you heal the gut, and it's why it's so important, and why when you heal the gut, many people will have a reduction in body pain because it will lower overall inflammation and it will reduce us attacking ourselves, right? So don't beat yourself up. Don't do it. There are new ideas about how pain, and I've alluded to these, right? The role of the brain and the central nervous system, really, it can dampen the pain. It can worsen the pain. You all know in times of stress, that pain hurts more. When I'm stressed out, the back hurts more. And this is because your brain and your mind is intimately associated with your perception of pain. And so we really want to look at, there's newer theories coming out. The Neuromatrix Theory of pain kind of says that our pain is a multidimensional experience. It's like a neurosignature, not just by the neurons, but also it's influenced by genetic, psychological, cognitive aspects. We know that we can start to have what they call central sensitization. That means in our brain, in the central nervous system, it can perpetuate the brain. It can do something called like a wind-up, where our body will become reactive to normal inputs. Okay. We also see that some people definitely have a genetic blueprint that leads to the same pain hurting them more than other people. Okay. And there are specific genes that can predispose individuals to having more pain that can also affect their response to pain medications, right? Some people need a lot of pain medications. Some people need a tiny bit when they're having surgery. And this is important if you don't know about what your genotype is. If you're going into surgery, some folks are going to need a lot different, will need different pain medications, different anesthesia according to their genetics. And, understanding now that you know about neuroplasticity, that is, no matter how old you are, you have baby neurons that are being made that you can cultivate, and you can choose to create new pathways in your brain, new pain pathways. And the Curable app is a powerful way to do that. I love the Curable app. And start to utilize this biopsychosocial model. Like, it's unique to each of us. It's our emotions, it's our history, and know that we're seeing all kinds of great new ways to help pain. Cognitive behavioral therapy, this has clearly shown to be helpful, but it's a little different these days. The goal of mind body is to reduce pain to nothing, right? Let's reduce that pain to nothing. Using mindfulness and meditation, using biofeedback, yoga, tai chi, hypnotherapy, all these are new ways that you can reduce your pain. And I want to help you with feeling your very absolute best. So reach out to me if you are curious about how can you get to be part of the Energy for Life holistic healing and anti-aging exclusive community, because I'd love to have you have your input and see how far we could take your health into health nirvana. All right, you guys, I just hope that this is a beautiful day for you, and I look forward to seeing you in the very near